Disease transmission.
In an emergency, some people may hesitate to act because they fear the threat of disease transmission associated with contact of bodily fluids. Infectious diseases range from the common cold to more serious diseases, such as HIV.
Infections occur when germs such as bacteria or viruses enter the body and affect one or more organs.
When administering first aid, the threat of disease transmission is minimal, and certain safety measures can help reduce the risk. A set of personal responsibilities called universal precautions can be used to prevent disease transmission.
These include wearing protective equipment, frequent and thorough hand washing, using gloves and breathing barriers when providing first aid, and avoiding contact with contaminated objects or materials that may puncture the skin. Gloves are an essential part of any first aid kit. Use gloves whenever possible while performing first aid. Gloves help to keep a barrier between you and potentially infectious bodily fluids. To correctly remove gloves, make sure you do not come into contact with the outer surface. Peel the first glove off from the wrist, turning it inside out. Bunch it into the palm of the opposite hand. To remove the second glove, grab it from the inside at the wrist and roll it off. Use a biohazard bag to dispose of any contaminated materials.
There is a small chance that infection can pass from one person to another during rescue breathing. Therefore, it is always a good idea to have a breathing barrier easily accessible. If resuscitation is needed, breathing barriers with one-way valves are very effective tools a rescuer can use to protect themselves from the contact with blood, saliva, or vomit.